Good morning to everyone that is joining us. We are going to be getting started here in just a few minutes. We are slated to begin at 11 o'clock. I'm glad you're here. I'll give you more instructions here as we get closer to the hour. Thanks again. Good morning, everyone. My name is Regina Ward. I am a member of our Chamber of Commerce team here in Rutherford County. We are so excited to have each of you online with us this morning. Today, you're going to be hearing a presentation that is a part of our Employer Showcase from the Tennessee State Veterans Home. We have with us Melissa and Melanie from the HR team and from their marketing department. We are excited for you all to have an opportunity to learn a little bit more about some of the jobs that they have available, and to learn a little bit more about their company culture and what it's like to be a member of their team. Before I turn it over to Melissa and Melanie, I want to remind you all of a few housekeeping things. Please keep your microphone and your phone on mute so that we don't have a lot of background noise. As they are presenting, you'll be able to hear them clearly. We are also recording this session for our YouTube pages. So if you miss a little piece of information or want to come back and watch it later, you will have access to do that after today. And last but not least, the chat box is going to be open for questions. If you have questions throughout their presentation, please feel free to place those in the chat. I will be keeping an eye on those and then feeding those questions to our presenters at the end of their presentation time. So without further ado, I'm going to turn it over to Melissa and Melanie. Thanks again for being here.
Awesome. Thank you, Regina. Hi, everyone. Thank you so much for joining us today. My name is Melanie Cook. I'm the Marketing and PR Manager with the Tennessee State Veterans Homes, and with me, I've got Melissa Career. She's our HR generalist with our Murfreesboro location, and that is the home we are recruiting for today. So Melissa, are you gonna, I guess, flip through the slides for me?
Yes, ma'am.
Awesome. So I wanted to just give a very brief overview of who we are and what we do. You know, a lot of people, when they hear Tennessee State Veterans Homes, there's a little bit of confusion. They think, oh, do you build homes for veterans, or are you part of the VA? We are actually a long-term care nursing home facility. Our Murfreesboro campus is located on the same campus as the Alvin C. York VA Medical Center. So A lot of people think we are actually part of the VA, which we are not. We are our own separate entity, which I'll talk about in a little bit. So just a brief overview. We serve veterans and their spouses. We offer them long-term care, skilled nursing, rehabilitation. And really our mission is just to provide quality of care for our veterans, enhance their quality of life by promoting socialization, veteran camaraderie, and offering them accommodations that foster comfort, dignity, and self-respect. You want to switch to the next one. So what we offer our residents, like I mentioned, skilled nursing and therapy services. So they can come to us short-term for rehab. They can see a physical therapist, occupational therapist, speech therapist to help them regain some strength or mobility if they're recovering from a surgery or illness. And then we also offer the long-term care. So that's the 24/7 nursing care. They live with us. It's long-term care, and we try to make it as home-like and supportive as possible. So our demographic is within our homes, all of our homes throughout the state, is that 75% of the residents at each facility are veterans, and then the remaining 25% can be spouses and Gold Star parents. So we're very, very happy to be able to serve both veterans and their families. So we have 4 current locations across the state that are active, up and running today. One in Humboldt, one in Clarksville, Knoxville, and then of course Murfreesboro. And we are in the process of building 3 additional locations. So we're really excited about expanding throughout the state to be able to serve more veterans. Our home in Cleveland, which is southeast Tennessee, is actually currently under construction and set to open in spring of 2022. So we're really excited to be able to serve more veterans. So our governance, like I mentioned, we are actually not part of the VA. We are a separate entity entirely. We're not a state department. We are considered a political subdivision. So that means we are appointed, our board is appointed by the governor that oversees our operations, but we've got a lot of benefits to that. One of which is we're not part of the state budget, so we set our own pay scale for our employees. And thank you. Sorry about that. And so we set our own pay scale, and we're also part of the state benefits program. So that's a very good benefit there. I want to hit to the next. So speaking of benefits, some of the really good options we offer our employees. Like I mentioned, we do have state of Tennessee benefits. So we offer employees retirement through the Tennessee retirement system. It's 100% employer paid pension, and we're fully vested after 5 years of service, which is huge. It's a really, really good benefit for our employees to have. We also offer affordable medical, dental, vision coverage. That's also through the state of Tennessee benefits. Paid time off, holiday pay, deferred compensation plans, so 401k, 457 plans, employee assistance plans, a sick leave, extended disability benefit. So that's really great if something unexpected comes up where you need to take some additional time off. You kind of have that extra, some extra hours to pull there where you can get some paid time off. Flexible spending accounts, bereavement leave, family and military leave, shift differential, free credit union membership, and discount meals available daily, which is really huge. Our employees really appreciate that.
I know I do.
Yes. And Melissa will talk more about some of our other benefits and open positions in a minute, but just wanted to briefly discuss some of the ways that we are set apart from other facilities, and that's in our and our quality of care that we offer. So all of our facilities are rated 4 or 5-star by CMS, which is the Center for Medicare and Medicaid Services. And that means we're above average in our quality of care, our staffing, and also our health inspections and our surveys. Our facilities, all of them, regularly have deficiency-free findings in their surveys, which means that these inspectors will come in and they'll inspect top to bottom. They'll do audits, infection control, the VA, the Tennessee Department of Health. They'll come in and just make sure that we're running things properly and efficiently. And we regularly have deficiency-free surveys, which means that they have found that there's nothing that we can currently change in our the way we're running it. And with COVID going on and the pandemic, we've definitely had some increased infection control surveys. And we're happy to report that every single one of our homes, we've had, I think, 9 surveys so far, and they've all been deficiency free, which is really a testament to the care and commitment that our employees and staff show, just making sure they're following all the right protocols and procedures to keep our residents healthy. So one way we do that is with our staffing support, which is what Melissa has up on the screen here. This is just a chart that shows our nursing staff hours per resident per day, or our PPD number. So that blue kind of neon line on the bottom shows the state requirement for our staffing hours. And the yellow line above shows the VA requirement. And then the 2 orange lines show the national average and the Tennessee average. So as you can see, we're way above the national and the Tennessee average for our nursing hours. So we're really proud of the fact that we can have a higher level of staffing and more support for our staff, which means our staff is happier and ultimately provide better care for our residents. I'm going to switch. All right, so I'm going to, turn it over to Melissa. She's going to talk a little bit about our culture and just some of the positions we have open at the home.
Thank you. We have some nursing positions available as well as non-nursing positions. These are posted on Indeed. We are going through a transition right now, so the amount of postings you may see on our website, if you do go there, may not reflect that. The open positions that we do have currently will be on Indeed. We have the hourly positions that if you do work over 30 hours, 32 hours, you're eligible for those benefits that Melanie had talked about earlier. Once you do apply, we would encourage you to follow up. You could go ahead and email me. I believe our email addresses are on here, or I can let you guys know those later.
Yeah, it's on the next slide. We've got our contact info.
Okay, perfect. And in the nursing department, we have RN, LPNs, we have some CNT positions available, as well as in dietary and environmental services. And then here is our information for following up if you would like to send us your resume. Indeed is going ahead, and like I stated earlier, we are in transition. They will be going ahead and reaching out on interviews and then submitting your information to us. A good way to get ahead of the game and get your name out there is to provide a initial follow-up, just to ensure that during this transition, we are able to get your information quickly and efficiently. Sometimes technology is different. It doesn't always work. But if there are any questions, I guess now would be a time that you can ask is there anything in the chat box?
Yeah, I've got a couple of questions for you both. So you all mentioned there are several different types of jobs available. For those specific jobs, those that need a specific skill set or certification to apply, could you elaborate on what some of those might be versus your positions that might not require a previous certification or a skill set needed?
Anything with like the RN, LPN, CNAs, those do require a CNA certification, LPNs, LPN licensing, RN. So you would be required to have those upon hiring. We do have a pre-onboarding process that requires that information to be taken and put into your employee file if you are hired on. So prior to, I guess when you would come in for an interview, we would make sure all of that was updated and you were eligible or qualified. The dietary cook, we do, well, I guess I should say all positions, we would prefer long-term care, but you know, it is not required. And then we do require a background check for all positions.
Perfect. You mentioned access to benefits after 32 hours. Is that correct?
Correct.
Okay. And then last we talked about follow-up. I see you all have listed your emails and phone numbers here. I will also be sending that out to the list of participants. So you all will have access not only to this video, but you'll also have the email addresses for Melanie and Melissa as well. I've got another question for you all. How long is the onboarding process, and how do you rate experience versus education?
We are based on experience is how we base our pay. So whenever you come in for an interview, if you are a good fit, we would pay based on that experience. And I'm sorry, what was the other question?
The other question is, how long is your onboarding process? So, you know, once you get that resume in and you've maybe been screened through the first call, what is your time frame from sending in your resume to you're working on your first day?
Well, normally we do try to reach out as soon as possible. With that said, we are in transition right now through a new platform in Indeed. So that's why I was kind of encouraging individuals to submit their application or their resume through my email, just so we can smooth out that transition in case there are any hiccups. I want to make sure that the process is followed, but also making sure it is smooth. Now, once we do an interview, find out you're a good fit, bring you on, we have to do a background check. Sometimes that can take, I don't know, up to 14 days. With this COVID right now, there are a lot of works offices that are closed, which causes a delay. But we do try to have orientations every couple weeks. And then in orientation, we do have a couple of days during the week, depending on if you've applied for an EVS position or say an RN supervisor. An RN supervisor, those orientation days would be longer. Maybe there would be 4 days for, say, an RN supervisor. And then if you were a dietary cook, you would be in there for 2 days, and then you would go and train in your position on the 3rd or the 5th day.
Wonderful. You mentioned the background check being a part of your onboarding process. Is that something that the potential employee needs to pay for, or do you all pay for that cost for the background check?
The background check is part of the pre-onboarding process, and we do go ahead and submit that, and we do pay for that. You would not be responsible for that.
Perfect. Thank you. Are there any other questions that anyone might have? I'm going to leave the chat box open for a few more seconds. I know sometimes it's like waiting on somebody to text you back. We try to wait a couple seconds to make sure we didn't miss anybody. And I don't see anything else being added. So again, Melissa, Melanie, thank you for placing your information in here. We will send the slides, copy of this presentation to all of you that have signed up. Again, I will echo Melissa and Melanie's request. Please send them your resume directly. I know a lot of folks are out there looking for jobs right now, and we want to make sure to get you to the right person and get you in there quickly. And they've already given you all great instructions on how to be able to do that. So please reach out to them directly. And I thank each of you for wanting to be a part of today. We will continue our employer showcases. Next week is our manufacturing week, so we will have manufacturers listed, and we have 2 more presentations this week. So we hope you all will join us then. Thank you so much, Melissa and Melanie. Everyone have a good day.
Thank you.
Bye.
Bye.